to today's webinar, Empathy and Emotion Regulation, Training Complementary Skills for Well-Being. I'm Stephanie Adler-Yuan, Director of Education and Training here at the Schwartz Center for Compassionate Healthcare, and your moderator for today's session. The Schwartz Center for Compassionate Healthcare is a national leader in the movement to make compassion a vital element in every patient-caregiver interaction. Before we begin the formal presentation, let's go over a few details about our webinar. The Schwartz Center Compassion in Action webinar series is funded in part by a donation in memory of Julian and Eunice Cohen. Today's program will be 60 minutes long, and for the first 45 minutes, we'll have a presentation, which will then be followed by a 10-minute question and answer session. Today's program is being recorded, so for your colleagues who weren't able to make it, you can let them know it will be available on the Schwartz Center's website within 2 weeks after our session. Please note that as an attendee, you're participating in listen-only mode, but you can interact with our speakers by using the questions pane on your screen. If you have any questions, and we hope you will, please just type them into the questions pane and send them to us, and we'll address as many of them as we can at the end of the presentation. Last but not least, as you exit the webinar, you will receive from us an electronic survey that we'd love for you to take a minute to complete so we can capture your assessment of today's program. Your feedback is really important to us, so please fill out your survey. And now, it's my absolute pleasure to introduce my colleague and our host for today's session. Dr. Beth Lown is Chief Medical Officer of the Schwartz Center for Compassionate Healthcare and Associate Professor of Medicine at Harvard Medical School. Welcome, Beth.
Thank you, Stephanie. Good afternoon, and thanks to all of you for joining us for today's Compassion in Action webinar. You may know that this year we are hosting our second National Compassion in Action Healthcare Conference, which is going to take place here in Boston this September 8th through 10th. We have developed this conference 2 years ago, and it is a wonderful opportunity to bring together clinicians, health system leaders, and others who are active and committed to making compassion a priority in their organizations and in their communities. So in anticipation of this year's conference, this year's Compassion Action webinar series is featuring speakers whose work has inspired innovation, leadership, and culture change in some of the areas that we'll be focusing on during our upcoming conference. And these include workforce resilience, well-being, and engagement, creating compassionate organizational cultures, compassionate responses to social change, communicating with patients, families, and each other, and engaging patients, families, and their communities to support health. Today, we're really excited to be joined by psychology researcher Tammy Crow, a doctoral student at University of Wisconsin-Madison, who's doing some really fascinating work. She's working with a highly esteemed researcher and thought leader, Richie Davidson, at the Center for Healthy Minds. And she's been using a combination of brain imaging and behavioral measures to build our understanding of the neural and behavioral processes that underlie emotional experience. We'll hear from Tammy about this work and about some of the training she's been developing, where she uses actually video games to develop empathy and mindfulness meditation to improve emotion regulation. So welcome, Tammy. We're delighted to have you begin your presentation.
Thank you, Beth. It's a pleasure to be here today.
Well, why don't you just launch right in, and we're excited to hear you share some of your findings of your research.
Thank you. It's a pleasure to be here. And so, as you mentioned, I'll be discussing training for empathy and emotion regulation and how these skills might work in a complementary way to improve well-being. And so just to give a brief overview about what I'll be discussing today, I'm going to start off with some definition of terms just to get us all on the same page. So I'll talk about what is empathy, including psychological and neural processes that support empathy. I will discuss ways that we have been measuring empathy in our laboratory research, as well as a novel video game empathy training intervention that was developed at UW-Madison in a collaborative effort between researchers, including myself at the Center for Healthy Minds, as well as Gear Learning, which is an educational game development group here at UW-Madison. Then I'll talk briefly about a separate line of research in which we have looked at neural mechanisms underlying improvements in emotion regulation with mindfulness meditation training. And finally, I'll talk a bit about how these two lines of research might inform a complementary approach to improve well-being. Okay, so diving right in, what is empathy? So you might have an idea about what empathy means. And on the next slide, I will talk about what I mean when I use the term empathy. And so in the scientific literature and in my work, when I use the term empathy, I mean this general ability to understand others' emotions. And you might have a more specific idea of how you would define empathy, and I'll get to that in just a moment. There is a lot of research to indicate that the ability to understand others' emotions, or empathy, might be a first step in altruistic behavior. So if you understand someone's emotions, you may then become more motivated to help them. And relevant to my work with teenagers, empathic skills are associated with less bullying. That is, individuals who are better able to empathize are less often the victims of bullying. And it's also associated with decreased internalizing symptoms in teenagers, which are associated with depression. And so on the next slide, I will talk about how empathic skills can also be relevant for patient relationships. And so there's a really interesting, relatively new area of research which has really grown in recent years that indicates that empathic care in patient relationships and really in helping professionals in general, so both medical professionals as well as counseling, social work professions, that when you interact with empathy, that you see a number of benefits. And so these include, particularly in the medical realm, improved outcomes for patients, greater patient satisfaction with their interactions with providers, and better adherence to treatments. On the flip side, physicians report greater professional satisfaction. And so there's benefits potentially for both providers as well as patients. And at the bottom of this slide, you can see a reference to a recent review article that does a really good job of covering this literature, as well as discussing some potential mechanisms for how empathy in patient-provider relationships might lead to these benefits. And so while there are all these benefits, as you may know, there also is a flip side to empathy, or there can be, which is that it can relate to provider burnout. And so particularly, as I'll discuss in a moment, with certain forms of empathy, engaging in them regularly can lead to distress and ultimately what's referred to as burnout. And so I'll talk a little bit more in this presentation about why that might be and how we might counteract that without losing all of these wonderful benefits of empathic care. And so on the next slide, I will talk a bit about the processes that support empathy. And in the psychological literature, there's a lot of support for two different processes. And as I mentioned earlier, when I use the term empathy, I'm referring to this general ability to understand others' emotions. Understanding others can come from a number of different forms of information or abilities, including these two here. So one form of empathy that has been described is called perspective taking. It's also referred to as cognitive empathy. And this is really the ability to think about how another person is feeling, to understand their thinking. It involves using information from the context of an individual's experience, perhaps things that you know about that individual's motivations, goals, On the other hand, experience sharing is the other main psychological process that has been shown to support empathy. And this is the more affective form of empathy, is how it's described in the literature. And this might be, I think, the more common uh, form of empathy that people refer to when they use the term empathy. So experience sharing, as the name implies, is really sharing in the emotional feelings of another person. And so you're really feeling that emotion, whereas perspective taking is more about thinking, the more cognitive aspect. And on slide 11, I will show how these processes are actually supported by separable brain networks. And so just to orient you to the images here, so we have two different aspects of the brain. On the left is the medial aspect, and so this is a slice down the center of the brain. And on the right is the lateral aspect, so this is the side aspect of the brain. And the way these two brains are situated on the slide is as if two individuals are looking eye to eye. So the front of the brain is towards the center and the back of the brain is towards each side. And in blue, you can see regions of the brain that support the ability to share in another person's emotional experience or affective empathy. And in red, you see regions of the brain that have been found to support the ability to take another person's perspective or cognitive empathy. And these two forms of empathy have been looked at in the scientific literature using two different sorts of tasks. And so with experience sharing, the sort of stimuli or in the tasks that are used in research involve things like looking at images of people who are in pain or snapshots of a emotional facial expression. Whereas perspective taking, the literature on that generally uses a very different sort of task in which you have stories, so narratives about emotional experiences or cartoons that depict a storyline. And just to highlight a couple of these regions that I'll be focusing on later, so particularly for the perspective taking network, you can see the medial prefrontal cortex on the left portion. The left brain is in the front middle section of the brain, and that will be relevant to some of our results and research I'll be talking about later. And then on the right side, in the lateral aspect of the brain, you can see the temporal parietal junction, which is often referred to as TPJ, and that's in the back portion of the brain on the right. It's a kind of a small region. And so those are two parts of the perspective taking network, again, that I'll be talking about a little bit later. And so next, I'd like to take just a brief moment to find out your feelings about how you feel when you empathize with others.
Fantastic. This is Stephanie. Thank you so much, Tammy. That's fantastic. So if everyone who's on the line could please take a moment to click over to your screen and answer our quick poll and let us know when you are empathizing with others in general, if you can generalize, what is it that you feel? Is it that you feel warmth and compassion? Does it stress you out? Do you ever feel sadness when you're empathizing with others? Is it some combination of those things that we've asked you above, or is it none of the above? Is it something else entirely? All right, so let's see what we've got here. Okay, I'll give you one more second. We've got almost everybody weighing in. And if you haven't weighed in, I'm sorry. We're gonna call this critical mass. We're gonna close the poll and share our results. So Tammy, here's what we've got. We see that many people say they feel warmth and compassion, a full third of our crowd here. We have 0 respondents saying that they feel stress associated with empathy, 4% feeling some sadness, majority choosing the combination of the above, and then very few feel none of the above. So what do you think of that?
Thank you. That's really interesting. I think so. I should have said at the outset, there's no right or wrong answer to this question. So there's a number of different ways that you could potentially feel when practicing empathy. And I think we most often associate empathy as a positive emotion with warmth and compassion. But we also know, as from the literature that I was discussing earlier, that it's associated with, it can be associated with burnout. So there must be some that potential negative feelings as well. And so it makes sense to me that most folks would feel a combination, possibly a combination of positive and negative emotions. And on the next slide, I will talk about two of the main sorts of responses that people feel when they're empathizing that have been described in the scientific literature. And so one of the main responses you can have is that of empathic concern. And that's kind of this compassionate, warm feeling where you're focused on the target of empathy, the person with whom you're empathizing. And this is associated with altruism. So you have a warm feeling that you want to help this person. The other main form of response that we see is that of empathic distress, which is exactly as the name implies. This is kind of that stressed out response when empathizing that is more focused on the empathizer. And this is where we might need to employ emotion regulation skills. And so next I'll discuss what I mean when I say emotion regulation. So again, very generally, emotion regulation is simply the ability to alter one's emotions. And usually when we use this term, we're of course referring to the beneficial forms of emotion regulation. However, it could have beneficial or potentially negative consequences depending on the type of regulation that's being employed. And so explicit emotion regulation strategies are strategies where one is consciously trying to change their emotion. So these would include cognitive reappraisal or positive reframing, so trying to see an experience or a situation in a more positive light. That would also, explicit strategies might also include suppression of a response, and whereas cognitive reappraisal is generally associated with beneficial outcomes for well-being, suppressing one's emotional response is a regulation strategy that is associated with negative impacts on well-being. There are also more implicit or automatic forms of emotion regulation, and these include things like extinction learning. And so these are forms of regulation where you're not trying to consciously change your emotion, it just is happening automatically. Emotion regulation is supported by a couple important brain regions that I'll be talking about throughout this talk, including the amygdala, which is shown here in green, as well as prefrontal cortex, or PFC. I've highlighted one region of PFC here in fuchsia, and this is the ventral medial prefrontal cortex. And I have indicated their connectivity with this dotted line, so they're not actually connected outside the brain like that, but to indicate that the connectivity of these regions, both structurally and functionally, is associated with better regulation ability. And so next, I would like to ask you all one more polling question. I'm curious to know whether you've learned any strategies to regulate.
Okay, sorry, I had a little issue with my muting. So here's the question. Have any of you learned strategies to regulate your emotions? Select one of the following. So we have cognitive reframing or reappraisal, mindfulness-based stress reduction or MBSR, compassion meditation, acceptance, or another strategy. So if you wouldn't mind just taking a quick moment to let us know how you choose to, or maybe you don't choose, maybe it's something you do automatically, but how you choose to regulate your emotions. Cognitive reframing and reappraisal, MBSR, compassion meditation, acceptance, or something else entirely. Okay, I think we're approaching 100% of participation. Any stragglers there? Last call. Okay, let's see our results. Okay, this is so interesting. Wow, we've got some interesting results here. Um, let's share our results and see what we think. So, Tammy, we've got a third of the group saying that they engage in cognitive reframing or reappraisal. We've got another third who engage in mindfulness-based stress reduction, which is a tongue twister for me today for some reason. 15% engage in compassion meditation, 14% practice acceptance, and 10% something else entirely. And if you have another strategy you want to share with us, feel free to use that questions pane. So what do you think of that, Tammy?
I think that's really interesting, and it's in line with what I'd expect. So, mindfulness-based stress reduction and cognitive reappraisal or reframing, basically cognitive behavioral forms of emotion regulation, are two of the most popular and most evidence-based forms of sort of therapy or emotion regulation strategies that are often taught to individuals. But it's really interesting to see that these other compassion meditation, acceptance, those are also forms that you see that are taught. I'm curious to see what other strategies folks might use. But this also makes sense because there are a lot of individual differences in terms of what works best. And so what works best for one person to regulate their emotions might not be the exact same thing that works well for another person. And this is something that is a really important future direction of the research that myself and other researchers at the Center for Healthy Minds, as well as researchers in the field, are working on, is how do we identify what type of strategy or what type of training works best for any given individual. So thanks for responding.
That's great.
And
Thank you,
so,
Tammy. I'm going to just pipe up to say we also had a comment from the audience, from one of our attendees, asking why there was no combination option on this one. So we want to also sort of explore the fact that some people might be engaging in more than one of those strategies, right?
yes, that's a good question. There should have been a combination option. There's even mindfulness-based cognitive therapy, which is something that combines mindfulness and cognitive reappraisal strategies. So that's a really good thing to point out.
Absolutely. All right, moving on.
All right, so now I'm going to dive back into talking about empathy again. So switching gears a little bit, and I will describe a task that we've been using in the lab to measure empathy and the importance of having a behavioral component to that measure. So in this case, accuracy. So on slide 17, I will walk you through this empathic accuracy task. And this is a task that has been used for many years in the psychological literature, in the behavioral literature. So this was developed by William Ickes, and it was later adapted for use in the fMRI scanner. And that is the version of the task that I'll be talking about, which we have utilized to look at the neural bases of empathic accuracy. And so in this task, again, it's a behavioral measure, so you get this accuracy measure, and it's also very naturalistic, especially compared to some of the tasks I was describing earlier that were used initially to sort of identify those perspective taking and experience sharing brain networks. And so this task involves taking videos of people talking about emotional events from their life. And so rather than having just a still image that sort of doesn't have any context, or having a cartoon narrative where you don't have any emotional expressiveness, the empathic accuracy task is great because it combines opportunities for individuals to both take the perspective of another person through the narrative context, as well as to share in their emotional experience, potentially, because you see the emotional expressiveness of their face. You also hear the emotional tone of their voice as they're telling their story. And so in the next panel, I'll show you there's a screenshot of the task. And so after we record the videos, we have the person who's in the video, I'll refer to them as the target. They complete this task themselves. So they watch the video and they rate their own emotion in the video on a scale from very negative, which is on the left here, to very positive, which is on the right. So as they're watching the video, anytime their emotion changes, they're instructed to change their rating to go along with the negativity or positivity of their emotion at that given time. In a separate set of people, who would be the empathizers, we have them complete this same task. And so while in the fMRI scanner, we have people watch these videos of targets and essentially empathize with them. So they rate the target's emotions from negative to positive on the same scale. And in the final panel of this figure, you'll see an example of how we calculate the empathic accuracy score. And so these are just two kind of cartoons of potential time courses of how the ratings might unfold. And so in green, that might be a target's response to indicate how they felt during that video. And then in pink, that might be a potential empathizer's response, so the person who's watching the video in the scanner. And a high empathic accuracy would be a high correlation between the empathizer and the target in terms of how the target is feeling. And a low empathic accuracy, which I don't show here, but that would simply be a low correlation. So it's a correlational measure that's importantly grounded in a really relevant outcome, which is the target's own ratings of their emotions. And so this is the task that we've been using. And as I mentioned, it was adapted for the scanner. And on slide 18, I'll show you the initial results where researchers have examined the neural bases of empathic accuracy in adults. And so this work was done by Jamil Zaki under mentorship of Kevin Oxner at Columbia. And they were the ones who initially adapted this task for the scanner. And interesting, what they found was that the ability to empathize in an accurate way is supported by brain regions in both the network underlying perspective taking and that underlying experience sharing. And so in green here are regions that they pulled from the literature that were a part of both these two networks. And so pardon the acronyms in this figure I pulled from their study, but so you can see inferior parietal lobule and premotor cortex are the two regions on the left that are a part of the experience sharing network. And on the right, you see two subregions of the medial prefrontal cortex, which is one of those regions I highlighted earlier that's a part of the perspective taking network. And in yellow are regions in which in their study, they found brain activation was associated with greater empathic accuracy. So it's really cool to see in this totally separate, more naturalistic type of task that you see both of these networks pop up. And then we, like I said, we utilize this version of the task in our research. And we wanted to ask the question about whether these networks were both relevant for empathic accuracy in teenagers, since we then wanted to look at this video game to improve empathy in teenagers. And so on the next slide, actually, next we will show a brief video. It's a couple minutes long, but I really want to give you a taste of how this task works. So you'll see an example of one of the videos that we showed, and it's a person talking about an emotional experience from their teenage years. And so we wanted this to be relevant to the teenagers in our study.
All right. Well, when I was a freshman in high school, my grandpa got pretty sick. I don't really remember what was wrong with him because my parents and my relatives didn't really tell me anything. But I think he had maybe lung cancer or some form of cancer. But anyways, he was sick and in the hospital, and no one ever really brought me to see him. But then my mom said that she would bring me to the hospital to see him one day. So at the time I was learning how to sew, so I made him this like sock monkey thing. The sock, and it was really ugly. It's like the first thing I ever made, really. But my mom told me to bring it to him anyways. And when I got to the hospital, he was so sick. He had like a ventilator and stuff, and he couldn't even open his eyes or move. So I didn't really know what to do. My mom said, just tell him about my day. So I told him what was going on with me. And then I told him about the sock monkey I made, and I gave it to him. I placed it under his arm. And then suddenly he grabbed my hand and squeezed it, and we just kind of stood there for a while, and I held his hand. And then I had to go. But that was the last time I ever saw him while he was still alive, because he passed away shortly after that. But it just made me feel really good to know that he knew that I loved him and had made him something. And then at the funeral, someone had put the sock monkey thing in the casket with him. That was really nice, and it was really sad, but it still made me happy to know that he had it with him.
Okay, so hopefully you can see from that video that the task is really engaging. So in this case, it was very sad. And I wish I had time to show you a more uplifting video to bring you back. But while it was sad, the video had both positive and negative emotional content. And so we in the task we employ about half of the videos have an overall negative emotional tone and half of the videos have an overall positive emotional tone. So they're not all sad videos. Other events people describe are their first kiss, winning a track meet, things like that. And so here you can now see the results of this research we did with teenagers. And so we had some surprising results. First, in red, you can see the dark red sort of geometric shapes. Those are regions from the literature that are a part of that perspective-taking network. And then the yellow-orange is data from the study, again, in teenagers doing this empathic accuracy task. And so the yellow-orange are regions of the brain where activity relates to better empathic accuracy. And so here what we see is that activation of this perspective-taking network relates to a better ability to empathize in teenagers. However, in blue, again, the sort of geometric, circular, squarish, dark blue areas are regions that we pulled from the literature that are a part of that experience sharing network. And the light blue is the result from our work, which lines up pretty well with that experience sharing network and indicates that when these teenagers are activating parts of their brain associated with a shared emotional experience, they're actually having lower empathic accuracy. So they're having a more difficult time empathizing, which was really surprising to us, but interesting. And so on the next slide, I will talk about some potential interpretations for this surprising result. So as I mentioned, we saw that activation of experience sharing brain networks was associated with lower empathic accuracy in teenagers. And as I mentioned earlier, experience sharing can easily lead to empathic distress. There's a big literature on that in the scientific literature, and this is especially the case when emotion regulation is lacking, as you can imagine. And there's a separate literature in developmental psychology, developmental science, that indicates that teenagers have difficulty with self-regulation and emotion regulation in particular. And so our interpretation of this result was that it's possible that these teenagers were having difficulty empathizing due to the experience of distress following engaging in a shared emotional experience. And so thus, when we employed this video game training, we examined both networks that were relevant for emotion regulation as well as perspective taking in the brain. And so on slide 23, I have a depiction, just some screenshots of the video game that was designed. Again, this was in collaboration between researchers at the Center for Healthy Minds, as well as Gear Learning at UW-Madison, and that's a educational game development group at UW-Madison. So we're really lucky to have this wonderful collaboration. And the teenagers who played this video game were the same people who had come in for, and I think we need to go just back one slide to slide 23. So I'll just walk you through each of these screenshots. So the players had their brains scanned before playing the game, and then we have them play this video game. And in the game, they play a robot, and that's in the upper left panel. You can see the robot that the players play, and they've crash landed on this alien planet. And in order to get all the different parts of their spaceship and explore the planet, they need to learn to communicate non-verbally with these aliens. So they need to try to understand their facial expressions, their gestures, because they don't share a common language. And so in the top center panel, you can see an example of one of the empathy training aspects of the game, in which the players have to identify the emotion that's displayed here. And of course, this is a still screenshot, but this is dynamically moving video in the actual game. And the animation that's used to depict these emotional facial expressions is research-based. And so we had researchers from the Center for Healthy Minds worked side by side with the animators, and they were trained in the facial action coding system, which is a way of understanding emotional facial expressions based on the micro movements of facial muscles. And so that was actually used to have really lifelike animation and that was accurate emotional depictions. In the lower left, you can see an example of the empathic responding part of the training. And so players had the ability to choose a facial expression that the robot would display in response to the alien's expression. And then the middle lower panel, this is a part of the game where they were able to gauge the intensity of the emotional response. So they would move the slider up and down through time to indicate whether the alien got, just less happy, less sad, more sad. And then finally, in the lower right, you can see a depiction of the aspect of the game where the robot is navigating through the world. And so really importantly, all players who play the empathy training game, Crystals of Cador, they go through a certain amount of these empathy training aspects of the game at the start of the game. And then they're kind of set free to do whatever they want, similar to other video games. And so some players choose to continue to engage with this empathy training aspect of the game through the game narrative. And so you can kind of see, they're a little bit small, but the lower right panel, you see these little aliens that are kind of standing around. And so you can approach them as the robot, and there's a mission that you can help them basically with some task. And through that mission, you then brings up these different empathy training mechanics again. However, you can also choose to just kind of wander around exploring the planet. You have a number of different devices. You've got like a zapper tool, a magic wand. There's all sorts of plants and animals and other things happening on this planet that you can explore, which is great because that allows people to remain engaged in the video game, that we're not forcing them to do this sort of educational thing. And it's also great because we're measuring what they're doing in the game. And so on slide 24, I show some results in which we looked at their behavior in the game. So on the lower, on the x-axis here along the bottom, I have graphed their game engagement, specifically with the empathy training aspects of the game. And then on the y-axis along the side is the empathic accuracy related brain activation in the right temporal parietal junction, the TPJ. And again, that's the region, one of the regions that's a part of that perspective taking brain network. And so this is brain activation in relation to that empathic accuracy task. And what we saw was those individuals who engaged more with the empathy training aspects of the game had more of this empathy related brain activation in the right TPJ, which was really exciting. It didn't relate to other aspects of the game that weren't in relation to the empathy training. However, I should mention that we didn't see any changes in empathic behavior, our empathic accuracy measure. And so there's some good reasons for this. We had ceiling effects in the empathic accuracy measure and some of the empathy training components of the game. And so the teenagers we recruited for this research were really, really healthy, and they were really good at empathic accuracy from the get-go. And so I think it'll be interesting in this research to see if we were to use this video game and this empathy task in individuals who had some difficulty with empathizing, whether they would have more room for improvement, or whether we could increase the difficulty for individuals who are kind of already doing really well. All right, so yep, we can go to the next slide. in which I then looked at the effect of this video game empathy training on changes to brain networks relevant for emotion regulation. And I apologize, the labels, I don't have the labels here, but this is that same emotion regulation network I described earlier. So again, in green is the amygdala, and in fuchsia is the ventral medial prefrontal cortex. And here I'm looking at the functional connectivity of these regions while the teenagers are at rest. And so this is just how these regions interact in time. And what we found is that for individuals who played this Crystals of Cador empathy training game, which are the yellow dots, the more they increased in their strength of this emotion regulation network, the more their improvement in empathic accuracy. And this is compared to an active control game, which are the purple dots. We did not see any changes for that group. And I kind of glossed over that, but this is a randomized controlled trial. So we had a really well-matched active control to compare our empathy training game to. And so this is really exciting for us because it also lends some evidence to regarding the importance of emotion regulation skills for empathy, to see that improvements in emotion regulation networks, in this case, was related to improvements in empathic accuracy with this video game. And so next I will kind of change gears again to talk briefly about a separate line of research in which we have examined the neural mechanisms underlying improvements in emotion regulation with mindfulness meditation. And on slide 27, I'll briefly define what I mean by mindfulness meditation. There are a number of different ways it has been described in the literature. And the form of mindfulness that we have been studying is mindfulness-based stress reduction. And it has been defined as attention that's focused on present moment experience without avoiding negative feelings or clinging to positive feelings. So really staying in the moment with your experience and not trying to grasp on it or push it away. Experience a given emotion, notice it, and let it go. This involves practicing seeing one's thoughts as temporary, as impersonal, and it has been found to improve a number of symptoms of anxiety and depression, as well as to improve mood, and importantly, to improve emotion regulation skills. So there's a large literature in the clinical realm to provide evidence that mindfulness leads to these benefits. And we wanted to know what are the neural mechanisms that might support these improvements. And on slide 28, I will describe some of our recent findings. And again, this might look familiar to you. So we looked at that same network, the amygdala ventral medial prefrontal cortex, and we looked at the connectivity of this network while individuals were looking at negative and positive emotional images. And so this is, again, I don't have a lot of detail here for time, but we had a randomized control trial. And so before and after a mindfulness-based stress reduction intervention, we measured the brain connectivity in these regions, as well as the activation of the amygdala in response to these emotional images. And what we found is depicted on the left. So in the red-orange is the brain connectivity of individuals following mindfulness-based stress reduction. And in blue is the connectivity of individuals who were in the active control comparison. And what we see is that the mindfulness intervention led to increased connectivity of this important emotion regulation network when individuals were viewing these emotional images. And that's associated with greater regulation success and greater wellness. And so this was really exciting to have this neural marker of better emotion regulation. And so finally, I'd like to just describe a few thoughts on how these two types of training, emotion regulation training and empathy training, might be brought together in a really complementary way. And so on my, here I have just a few thoughts and some additional information from the literature regarding this combined approach. And so the improved emotion regulation that we see through mindfulness meditation has a great potential to mitigate the empathic distress that can come from empathizing, particularly, again, with that affective form of empathy where you share in the emotional experience. The review that I highlighted earlier that talked about the benefits of empathy for patient care also describes some research that indicates that regulating emotion can actually increase empathic concern. So it potentially has this dual benefit of decreasing empathic distress while increasing concern and potentially increasing compassionate behavior. There is also one study that I found that provided initial evidence that a mindfulness-based intervention for physicians might actually improve empathy and at the same time lower burnout. And so there isn't a lot of literature specifically on this that I have found, and this wasn't a randomized controlled trial, but it's a really important first step, I think, in looking at whether we can use mindfulness-based interventions to both improve empathy and emotion regulation. And I think this might be particularly useful in helping professions, again, to avoid burnout by lowering distress, but also without losing the benefits of empathizing. So I think it's really important to continue to train in empathy and to incorporate that into patient care, given all of the great benefits, but also to see if we can mitigate the potential negative impacts of distress through emotion regulation training. And with that, I would like to thank you all for listening, and a really big thank you to the sponsors of this research, as well as my mentor, Richie Davidson, and particularly Jeanette Mumford for her mentorship and help. And of course, all of the participants and their families. This research, we had over 180 teenagers and at least 100 different individuals participate in the mindfulness-based stress reduction study. So thank you to everyone.
Thank you so much, Tammy. This is Beth, and it's just so incredibly fascinating. I find all of this sort of social neuroscience research very, very important in sort of showing some new ways of thinking about how we can help ourselves while we're helping patients and families. So we do have some questions that came in on our question pane, and I have some questions of my own, but I will go with our audience first. One person wanted to know whether or not you thought that there were some types of personalities, using something, for example, like the Myers-Briggs, to see whether there are some folks who are more predisposed towards experiencing empathic distress than others. Do you have any thoughts about that?
Yeah, I think that's a really good question, and it's a really I don't know of any research that has specifically looked at that. It might be out there in terms of like what particular types of personality characteristics might lead to empathic distress. Based on our work and the work of others, I would presume the personality characteristics that were associated with a higher degree of emotional sharing and lower ability to regulate one's emotions would be more associated with empathic distress. But that's a really important question for future research. Yeah.
Yeah, I think so too. I think this person also wanted to know if there was anybody who's been doing research on people who have shown themselves to be highly sensitive, although I think maybe what you're talking about is perhaps higher in empathic accuracy, but I'm not quite sure. Any research on people who are sometimes described as empaths?
Yes, I'm not. The researcher's name is not coming to mind at the moment, but I believe it is out there. And yeah, again, I think there would be individuals who tend to share in the emotional experience. So another term for that could be embodiment. So when you really like physically overcome with emotion, you're quick to laugh when others are laughing, you're quick to cry when others are crying.
Right.
You're probably more likely to then experience distress, but not necessarily. If you have practice with emotion regulation, I think you would be able to mitigate that.
I think that's a really important point, and I think we don't do a good enough job in incorporating strategies for emotion regulation in the education of health professionals early on and later when they're in their clinical placements and training experiences. And I was just wondering if you had any thoughts about how this might be applied to health professionals or people who are in training, some of your work, for example.
Yeah, that's a great question. I mean, the one study I had found, looking at the impact in healthcare isn't my primary focus, but in preparing, I was looking at this research, and it was exciting to see the one study showing that mindfulness could potentially improve both empathy as well as we know emotion regulation. So I do think that mindfulness-based interventions have a good potential to as a form of training for medical professionals. I also think it's important to recognize that regulating emotions is cognitively demanding. And so this is going to interact with other things that are demanding the cognitive resources of anyone, but medical professionals in particular, and especially thinking about the stresses of the job and the long hours, the fatigue. So all of these things, the sort of job stressors that might not you'd think directly be related to empathic care, but those are going to weigh on an individual's ability to regulate their emotions. And so I think it's really important to take a holistic approach in terms of the well-being of providers.
Yes, I think the key is how do you tip the balance from experiencing empathic distress to
Mhm.
experiencing empathic concern, which some people actually call that compassion. How
Mhm.
do we manage to do this? So you're suggesting, of course, that some forms of emotion regulation in various forms, whether it's MBSR or what some people might call cognitive compassion cultivation training, or combinations of things
Mhm.
that actually can tip the balance. I'm reminded I had a colleague who was doing some research and was wondering whether if you showed little narratives, much like you did, of patients describing their stories in addition to their symptoms, whether or not their clinical thinking, their clinical reasoning would be better or worse. And I think you're right. I think that there's something about both cognitive overload and also the demand that's placed on somebody young in training,
Mhm.
because their clinical reasoning actually was worse when they were watching the narrated stories and symptoms compared with when they just looked at clear descriptions, as it might be presented to them in text or in writing. So,
Interesting.
yeah, so then because I think this is really important, especially in
Mhm.
education. How can we somehow phase in training in emotion regulation in ways that aren't so demanding, uh,
Right.
that can be sustained over time because they're going to, need to be accessing those skills.
Right. And I think one important thing is that the literature does indicate that there's sort of an optimum level of emotional intensity when empathizing. And so experiencing essentially a little bit of that, emotional flavor, the experience sharing aspect of empathy might be helpful, but
Hmm.
it's just, you don't want to go too far into it. And so I think a little bit of that practice, but perhaps utilizing more of the cognitive empathy, the more perspective taking skills would also be important.
Yes, and probably both can be taught, as you've just shown here.
Mhm.
People wonder whether you can really improve empathic accuracy, but I think some of your research indicates that you can, whether it's from perspective, taking or some other ways. It's not, I think that's, um,
Right. And there's a couple other studies in the literature that also indicate that empathic accuracy can be trained.
mhm.
Um, there was one study that looked at training empathic accuracy with an in-depth acting class. And so it was
Yeah,
a pretty specialized study, but they had teenagers who were at an art school, and they found that those who engaged in this really intense acting class improved their empathic accuracy.
so really placing yourself in someone else's role, so to speak.
Exactly.
Yeah, yeah,
Exactly.
that's really amazing. That's great. Wait, we have some more questions. There's a lot of questions actually, so I have to stop asking my own.
Okay.
So people are wondering, again, they're wondering about applications. So for example, one person is wondering whether this kind of research has been applied for the purpose of therapy with people suffering from autism or autism spectrum disorders. Do you know anything about that, Tammy?
A little bit. I know that there are attempts to improve empathy in individuals with autism. I mean, I know that they haven't, as far as I know, there's been no like video game sort of intervention that's been used in that population, as far as I know of. That is one future direction that we thought this video game type of platform would be really useful for those sorts of individuals. When this research came out, there were actually a lot of parents who were commenting on a forum about how much their children who's on the autism spectrum, how much their children engage with video games. So that seems like it could be a really powerful medium to engage individuals on the autism spectrum. And if they have difficulty with empathizing, which often those individuals do, perhaps that could improve that for them. And so I think that would be a really important future direction.
Yeah, I think that's a great idea and a great application. I think we actually have to start to close out. I have one more question from the audience asking about the use of simulation training to increase empathic accuracy. Any thoughts about that? Well, I suppose the acting example you gave, in a way, if you switch out the roles, yeah.
Yeah, it's another really good, insightful question. I think that's it just points to a way that I think things are moving. But yeah, simulation as a way to essentially, you could have, one of my, I guess, slight critiques of some of the work with the in-depth acting school, it's really cool, but not everyone has access to that. But with new technologies, perhaps in virtual environments, everyone can participate in that sort of intensive acting experience or role-playing experience. Yeah.
Yeah, it's a great idea. Well, I think we do have to bring this webinar to a close. It's been incredibly interesting. I really enjoyed it. Tammy, thank you so much. I'm going to turn this back over to Stephanie to close us out.
Thank you so much for having me.
And thank you, Tammy, and thank you, Beth. And it's hard to bring this conversation to a close. I know there are a number of questions that we haven't got to, but we thank you all, our attendees, so much for keeping them coming. And I will share them with Tammy so that if she's able, maybe we can post some of the answers to questions we didn't get to on our website when we post the archived webinar. I also want to acknowledge, I heard from 2 people that there were issues with the video playback, and we apologize for that technical issue. We'll be looking into it ahead of our next webinar, but the video will be recorded as part of the recorded webinar that will be archived on our website. So if you didn't catch the video and you'd like to see it, just keep an eye on the website and you'll be able to view it there. And I think that's it for me. Again, I want to just thank you, Beth, for your wonderful hosting, and Tammy for that phenomenal presentation. And we hope that all of you enjoyed this Compassion in Action webinar and will join us for our next one as well. If you would like more information about the conference, you can take a look at compassionandactionconference.org. If you're affiliated with a Schwartz Center Healthcare member organization, we have deep early bird discounts for registration for individuals and teams. So check those out. And we hope that many of you will join us in September. Until then, we know how busy everyone is, but thank you for joining us. And please do take a moment to complete the survey upon exiting the webinar, as we really value your input and your feedback. Thank you everyone very much, and have a wonderful day.